This hospital in the Colombian coastal town Tumaco wasn't prepared for the pandemic. The intensive care unit was only built after COVID-19 had reached the city and infected thousands. Far from the capital, Bogota, the population here has never been the focus of government decisions. Now it's paying for the lack of health infrastructure, like many other remote parts of the country.
The coronavirus is riskier for indigenous communities. Lack of health services and clean water, poverty. Keeping variants out of rural Canada has been difficult, but adults in remote parts are getting priority access to the vaccine. Aboriginal and Torres Strait Islander people prevented widespread infections in Australia with their own travel restrictions. Their vaccine rollout is getting underway. Indigenous groups are also among the first to be getting the jab in New Zealand, the US, Canada and Brazil. But things don't look so good in Colombia.
Andres Rojas has been working for a year in the intensive care unit of the St. Andrew's Hospital in Tumaco. It's the only hospital in the far southwest of Colombia. A year ago, the clinic didn't have any intensive care beds. Things changed quickly when the COVID-19 pandemic began. At the start of the first outbreak, we had more than 2,500 patients. 21 of them died, and 17 were transferred to another hospital. Tumaco Hospital is one of many provincial clinics in Colombia that opened up intensive care units for the first time during the pandemic. It was only after the pandemic hit that we could even think about setting up an intensive care station. At the moment, it provides 13 units with monitors, breathing devices, electric beds, and staff who we trained ourselves. According to Dr. Rojas, some funding came from the government, but most of it came from private initiatives. Local businesses were especially generous with their donations. Tumaco is dependent on the tourist industry. This is an advertisement from Better Times. The location is the Pacific coast next to Ecuador's border, around 1,000 kilometers from the capital of Bogota. Tourists come here from around the world. Despite the location's popularity, medical infrastructure was largely ignored by politicians in the capital of Bogota. Before, the hospital had 38 oxygen tanks. Imagine that, trying to get through a pandemic with 38 tanks of oxygen. Thanks to donations from local business totaling 400,000 pesos, we could set up the hospital with a liquid oxygen tank. This helps a little, but the second wave of infections is now bringing a shortage of medicine. No one here can think about vaccines against COVID-19. The staff are approaching burnout. You can feel their tiredness. Some staff members have fainted from exhaustion. Their working hours are very, very long. At the beginning of March, 117,000 vaccine doses were delivered to Bogota. These were meant to reach 50 million Colombians. But nobody in Tumaco believes that they will get a single dose.
Juan Mario Diaz is a research fellow in the Department of Politics and International Relations at the University of Sheffield. Why is the situation so difficult in some of Colombia's marginalized communities?
Well, to understand the situation of these marginalized communities, it's important to take into consideration what former government called the historical depth of Colombian state with rural areas, which basically can be summarized in four aspects. The first one is the development gap, which refers to rural areas not having basic services like water, electricity, roads, hospitals, or schools. The second refers to social inequality and land concentration. According to Oxfam, 66% of productive land in Colombia is in the hands of 0.4% of the total population. Wow. The third one is the problem of the lack of state presence in some areas, as some of them are still under control of illegal groups. And the fourth, perhaps the most worrying, is the victims of the question victims, which, according to the 2013 report of the Center of Historical Memory, indicates that more than 200,000 people were killed in the last 15 years, and more than 5 million of Colombians were displaced from rural areas. So this is a picture that indicates why the situation is so complicated for these communities.
Juan Mario, can you tell me what happened to the peace process? Surely that has improved the situation in some way.
Well, the peace process is an important landmark in Colombian history. Initially, it was portrayed as a way of bringing to an end 50 years of war, which was a narrative that really strongly appealed to the international community. And this is why the peace process was surrounded by the international organizations. But what is interesting is what happened in Colombia during the 4 years that the conversations in Havana occurred. A series of national and regional forums were convened by the negotiating parties, which allowed people to discuss the points of the peace agenda. Basically, people get involved in discussing agrarian reform, political participation, the question of victims, transitional justice, and the substitution of illegal crops, which gave us the sense as Colombians that the peace process was a great opportunity to transform peacefully all of these social problems that we have historically had in the country. So that brings a lot of hope. But at the same time, the no referendum, the victory of the no camp of the referendum, plus the lack of implementation of the process is a matter of concern, as we see all the high hopes of the national population being met with no compliance and disillusionment.
Okay, so many social problems remain, especially for Afro-Colombian groups, I believe. How is the pandemic affecting their situation?
I think the pandemic has just made more apparent structural problems in the Pacific coast and in some rural areas. Just to give you an idea, just before the pandemic, 40% of public hospitals were closed. And so the former government declared a state of social emergency. When the pandemic came, hospitals in rural areas were completely unprepared to deal with that. And, well, basically the lack of resources and the lack of agency from some communities were just something that they really struggled to deal with. But what is more concerning for these communities is not just the virus, but also the reemergence of violence, which allow us to see the whole situation of a syndemia, which is the combination of the pandemic plus structural elements that impinge on bringing solutions to people and to dealing with the problem effectively.
So what's the best way to tackle the big divide in Colombia and ensure these people get treated or vaccinated?
I think the first thing we need to think about is how to depoliticize the way the pandemic is addressing the country. We cannot think this is a political problem, but as a social problem, as a health problem. So I think the government need to listen as well more what people is saying from the territory, from what the local administrations are, the messages that the local administrations are sending to the central government in order to get better results in the way that Colombia is dealing with this.
Okay, we'll have to leave it there. Juan Mario Diaz, thank you very much for being on the show today.
Thank you very much.
If you've got a question about the coronavirus, feel free to get in contact with our science correspondent, Derek Williams.
If you are asymptomatic and don't know you have COVID-19, is it dangerous to be vaccinated?
The short answer to this appears to be no, but it's a pretty complicated question. So, of course, there's a little more to it than that. Current advice from the U.S. Centers for Disease Control focuses mostly on whether or not people who've had the disease and recovered can be safely vaccinated afterwards. The answer to that is a clear yes. However, the CDC is far less clear about people who might have an active asymptomatic infection at the moment they get a shot. The implication, though, is certainly that there's no reason to think that vaccination would pose a danger. That's because the guidelines do say there's no need to test negative for infection before you're vaccinated. They also say that even if you've been exposed and have been tested and are awaiting results, if you live somewhere like a rest home, you should go ahead and be vaccinated as long as you don't have any symptoms. I'm sure the guidelines wouldn't say either one of those things if there were suspected dangers for people with asymptomatic infections being given the shot, and that the CDC would adopt a much more cautious approach. But it's important also to remember something else at the same time. If you know you've been exposed and are in quarantine but aren't showing any symptoms, don't go get vaccinated until your quarantine period has passed, because you might be an asymptomatic carrier. And even though we've established the vaccine doesn't pose a threat to you in that case, you could still pose a potential threat to people who are vaccinating you. So wait out your couple of weeks just in case to protect them.
And just briefly, the World Health Organization says the AstraZeneca vaccine rollout should continue for now. Some countries have stopped it over reports of blood clots. Finally, we leave you with images from Sao Paulo, Brazil's biggest city, now more of a ghost town. The usually bustling megacity of 21 million people went into curfew this week to try to stop the coronavirus from spreading. Several Brazilian cities are running out of hospital beds as cases rise and the crisis worsens. Thanks for watching.